Assalamu alaikum, hello, and welcome to another episode of Beyond Small Talk. I'm your host, Sadia Abdulaziz Muhammad, and on today's episode, we'll be discussing with two medical students to give us the highs and lows of studying one of the most difficult courses in universities. Please introduce yourselves for us.
Hello everyone, I am Rufaida G. Baba, a 300 level medical student at Yusuf Mutamasla University. I am thrilled to be here today to share my insights and experiences about medical school.
Thank you so much for coming, Rufaida.
Good morning, my name is Abubakar Muhammad Ismail, a 500 level medical student from Bayero University, Kano. I'm also the national president of Association of Kasana Medical Students and also a member affiliate of International Physicians for Prevention of Nuclear War and a blood access facilitator at Hyman Health Initiative. I'm honored to be here as one of your guests. Thank you very much for having me.
Thank you guys so much for coming. So, can you tell us how you found yourself in medical school? Did someone send you or did you guys send yourself?
Okay, so I have always wanted to become a doctor right from childhood. The idea of medicine has always fascinated me. But then along the line, as I grew older, I started developing interest in other fields too. I could remember I was once an MC in a school event, and after the event, a couple called me aside and the man asked me what I wanted to become.
Yeah.
So at that time, I wasn't sure because I had conflicting interests. I wanted to become a pilot too, but I still wanted to become a doctor. So I decided to just go with the truth and tell him what I felt at the moment. And I said, I have always wanted to become a doctor, but lately I've been wanting to become a pilot too. So the man laughed and he said, okay, I hope anytime I come for a flight, you're going to give me a discount. And he said, okay, if you want to make money, then please go for piloting. But if you want to help people, if you want to make a big difference in people's life, you have to make impact. If you want a reward that doesn't dwindle, then please go for medicine. So along the line, he was telling me that both he and his wife were both doctors. So at that moment, what he said resonated deeply with me. He reminded me of the real reason I've always wanted to become a doctor, the idea of helping people out at their weakest moments when they are sick. And then, the smile you get afterwards when people feel better has always been what's led me to this path. And afterwards, I was very sure it was medicine or medicine.
That's really nice. That's a nice story.
So I think it's virtually almost the same thing with me also, because I can't remember when I started developing interest in medicine. Maybe I think since time in memorial. And then, like she said also, I wanted to be a pilot also. Coincidentally, I don't know what happened. Because at the point I was like, okay, it's either medicine or piloting. But then, with piloting, the fees, and then the uncertainties in Nigeria, because there are stories that you have a lot of pilots that are out there without nothing to do. So I settled for medicine. And to be honest, I never had maybe any other option beside medicine. It's either medicine or nothing else. But then when I wrote my JAM, I was like, if I didn't get medicine now, I'll just settle for what I got. That's just it, because I'm not going to write another JAM. I can remember my second choice was pharmacy, I think. I applied for pharmacy. If to say I didn't get medicine, I'll go for pharmacy.
Okay, that's nice. So why do you think, like, in a typical class of students, you find that majority of them want to be medical doctors? Do you think it's because of the it's because the profession is noble, or is it because of wealth and status?
So with regards to that, I think if you ask any child, why do you want to become a doctor? What he will tell you is, I want to save life. So I feel it's not really about the money. And it's the human nature. All of us are carers. All of us want to heal. All of us want to help someone. All of us want to give back to humanity. So I think maybe it's that instinct of trying to do something good to others. Like you said, the moment you do something to someone that he feels happy, you see that smile. So I think all of us, it's maybe that instinct driving us to go and do something that will genuine something that will actually be helpful to others.
That's true. Okay, do you have anything to add?
Okay, I could say that I would go with what he said, and I believe at a younger age, like when we were in primary school, we were not exposed to many professions, because at then you would see, even if it is a debate in school, it's always teachers or doctors. So even with that idea that he said, that at that point we always want to care for people, because that is how we are trained by our parents, but we do not know of other professions too. If the same set of students you ask at primary school, if you go to a higher level and ask them, you will see that the numbers have declined for people that want to do medicine. Because at that point, they have been exposed to other professions. Some people have understood the demanding nature of medicine and they don't want that to be their portion. So they have thought there are other things they can still do to help and even give an impact to their society, and have chosen that to be their part.
True. Okay, speaking of demanding, I once read a book, and the beginning of the book was like, "Welcome to Harlington School of Medicine," also known as the biggest blunder you've ever made. So do you believe medicine is if your school came with a warning label, what would it say?
I think maybe you go first.
Okay, I think mine would say, warning medical school ahead, abandon all hope of a normal sleeping schedule. I love my sleep, and that is one thing I've had to sacrifice throughout medical school. I think that would be the warning.
Abandon all hope for sleep.
For a normal sleeping schedule.
Okay.
So mine, I think I won't say a warning label, but maybe I would say a welcoming label.
Okay.
Because I feel medicine is one of the most prestigious things one can ever do. And then so I would say maybe it would be like, welcome to medical school, where you get the chance to save someone, where you get the chance to give back to humanity. I think that would be
a welcome.
not warning.
Okay, that's nice. I can see you really love your profession. So how has your perception of medical school changed from before gaining admission to now? You're already 6 years in and 5 years, 5 years in and you're 3 years in. So how has it changed?
So a point of correction, mine I think is 8 years. This is my 8th year in medical school.
Right.
Yes, this is my 8th year in medical school.
Right.
Because I started in 2018. We are CLS 17. So I think the perception hasn't really changed, because maybe because I have a brother that's in medical school. Okay. So maybe I know what I'm going through. I know what I'm going to experience. But then, yes, like you said, experiences tend to mold us. Experiences tend to change us. So my experience will be, maybe I would say medical school is more of something tedious. Like, regardless of how you experience it, you will never know what you're going into unless you experience it. Regardless of what someone will tell you, you won't know. Because you come to a point whereby you miss a lot of weddings, you miss a lot of gatherings. Sometimes even some of your siblings that are young, you won't know when they are going to grow. Like, you just see them, so this person is in JS1, you're like, when? Because, exactly, more especially if you are not in town, maybe you're doing medical school outside your town. Yeah. So it's that's what I would say with regards to that question.
Okay, my perception of medicine has definitely evolved, because the first thing I bought when I was admitted, I bought notes and markers and highlighters. Because the videos I see on TikTok, they make the studying sound fun. Yeah. So I was looking forward to making notes, studying. I watched medical movies like Grey's Anatomy, New Amsterdam, and you would only see the thrilling adventures, the rush. It just sounds so, it will just be like some Harry Ranger stuff with blow bubbles and save life. But then the moment I started studying at my second level, the first year was easy because it was the normal sciences I was used to. But at my second year, before we started, I felt I was ahead of the class because I read my osteology for anatomy. So I was looking forward to the class. And the moment the lecturer came in and he did osteology, he did pectoral region, axilla, about 4 chapters in the same lecture, something I was hoping that I was already ahead. Like, he wouldn't reach me until after about 2 or 3 lectures. So from that moment, I was like, that is no longer business as usual. Because I was in for it, I realized that it is not really the only thrilling adventures, but this is something you have to give your all. You would have to tighten your belt and do better. It's not really what you see in the movies. It is actually, but then it is deeper to that. Like he said, you just have to experience it yourself, because no matter what somebody will tell you, you just have to do it yourself and find out how things work.
Okay.
But a point of, let me intersect. She said you have to give it your all. Yes, you have to give medicine your all. But then, what do you define as your all? Because the moment you join medicine, you are going to practice medicine throughout your life. Yeah, you find maybe in a class maybe of 100, maybe 10 will go out of medicine, maybe they will do other things. But 90 will surely maybe practice. Even among the 10, maybe 5 maybe might join again. So the moment you say you are going to give a medicine your all, the problem is at what cost? So I feel you have to divide yourself. You have to know that, yes, medicine is not part of me. And also there are other things that I have to do.
Yes.
So if you give it all of you, yeah, fine. But then at what cost, like I said? Because it's possible maybe there are other things that if you the moment you finish medical school, you'll be wondering, okay, I left a lot of things aside and I didn't experience that. And most of us will join medical school at a very young age. By the time we are finishing medical school, most of us are very close to 30, maybe we're in our late 20s.
Yeah.
So, like I said, you have to do a lot of things. You have to experience life. You have to go outside there and then do other things. Because at the end of the day, all of us are going to graduate a medical degree, an unclassified medical degree. But then, what value are you going to add to that medical degree matters? Because now skills really matters. Just not just degrees, but then add something to add a value to that medical certificate.
Okay. So an input on what he said, I actually meant, if you would go to a medical class, you will find out that you find the set of the most brightest students from secondary school. So we come in filled with, the confidence that we'll be able to do it. So what I meant was that normally, even if secondary school, you don't really need to finish the syllabus, even though in medical school, you cannot do that actually. But what I'm saying is that you just keep thinking it is the same, maybe effort you used to put earlier, but now you come to understand that this is something you would have to do extra for. Not doing other things aside, but like he said, it's actually true. You'd have to focus on other things too. But I meant like study-wise, you will have to know that you are in for something big. Yeah, that's my point.
Okay. So there's this narrative that medical doctors are usually harsh and dismissive in Nigeria. Like patients usually have this complaint. Doctors are supposed to be kind, welcoming, reassuring. So do you think this is true? And where does this problem originate from?
Are you going first?
Yeah, go first. I should start.
You can start, no problem.
Okay, so I think this is actually true. Sometimes this happens, even though if it's not always, but you do find scenarios where such a patient would complain of the way he or she was treated. And I believe maybe at student level, the pressure we go through and the stress will definitely shape how we behave with patients during our course of study and even afterwards. And even at a systemic level, in Nigeria, we know the doctor-patient ratio globally is 1:600 patients. But in Nigeria, as at February 2024, it is 1 to 9,083 or so. So you can just imagine the workload. You can imagine, and if we go, this is basic knowledge. Everybody knows the lack of resources in the hospital, the lack of manpower. I'm not excusing, I'm not giving excuses for their behavior, but I'm telling you that is why sometimes you would find them, because some doctors are just eager for you to go so that the next person comes in. Because they have a long list of people, to treat. But this is not, I think this is something that we need to address the challenges, because we need to develop an empathetic healthcare system that every patient would be willing to and would be, get the best treatment he or she can get.
All right, so with regard to that, let me first ask you a question. So if I ask you, are people good or bad? What will you say?
It depends on the person.
All right. And also, if you are going to rate maybe the good people you've met and then the bad people you've met in your life, which one will outweigh the other?
The good people, definitely.
All right. So what I'm saying is, yes, you have a lot of people that have the negative attitude. You have doctors that are on the other side.
Okay.
But then I think they are the minority. Like even like they are just like, let me say, their number is negligible. Like, they don't even represent the image. But yes, the narrative that's out there is doctors are really bad, doctors are harsh. But then, like I said, they are just doctors. Your experience with a certain doctor should be the thing that will say, okay, this person is this. Rather, not the job. You shouldn't say all doctors are bad. Rather, say, okay, this doctor did this. And like she said, if you look at the burnouts, I think medicine is one of the occupation that have the highest burnouts. Yes, because I think today I saw something. They said I think almost 46% of doctors report issues of being burnout. So you see, it's not easy, and this is not in Nigeria. So in Nigeria, to maybe like 80%. So imagine working for let's say 36 hours, because you do a call 24 hours, and then you have, after your call, maybe you have to work the other day. Yes. So it's not easy, and some of them, it's not really that they are harsh. but rather maybe we expect doctors to be, yes, we expect too much. Maybe we expect doctors, okay, if you come to a hospital, they should carry you. Maybe we expect that baby treatment. Maybe that's why we feel doctors are bad.
I think sometimes we forget doctors and human beings as well.
These people, some of them sacrifice a lot to be here. Some of them, they leave their families, they leave a lot of things to be here. So that's psychological issues. They also face it. So I feel doctors, if you ask me, I'll say doctors are good. But then, yeah, you can't see all the doctors. Like I said, people, you have good people, you have bad people. So based on that, that's what I will say with regards to that.
Yeah, very valid points. So what do you think makes one a very good or a great doctor? Like, you haven't started working yet, you're studying, but then you have your lecturers, your consultants, you go for rounds. So, like, the ones you look up to, what do you think made them different? Is it that they started from their studies, or is it when they started working? How does someone become a great doctor?
Like I said, medicine is a journey. Right from the moment you start medicine, I think it reflects a lot about what you're going to be in the future. The consistency matters because you can't finish everything in a 1 month. You can't finish everything in 2 months. You can't finish in 3 months. It's something that it's a continuous process. You read this thing today, and then tomorrow you'll search for it in your brain, and then it's not there. I think maybe both of us have experienced that. Maybe you finish reading more, especially pharmacology. You finish reading pharmacology, and then you want to remember the drug, the mechanism of treatment, like, why this?
It just seems as if they're flying out the stuff.
It seems like you've never even, sometimes they even ask you, have you ever heard of this drug? You'll be like,
no.
And maybe you read it yesterday. So it's a continuous process that you have to keep reading. You have to keep doing it day after day, consolidating everything, gathering everything so that you become good. And they said medicine is an art, and art requires practicing. You have to practice every day. Like today you go and pick this splenomegaly, tomorrow you won't. Maybe next tomorrow you won't pick this hepatomegaly, but then the constant practice will give you the skills at the tip of your hand. So that's why, like I said, I feel it's a continuous process. But then I'm not saying there are people that maybe if you look at the start of their journey, they were not really good. But then because maybe they changed and then later they continued doing this practice and so like now they are really exceptional. Yeah. But like I said, right from day one, you have to start knowing that, okay, I have this journey, this is what I want to be, this is what's ahead of me.
Okay, so I think definitely the journey to becoming a great doctor definitely starts from school, because I think that is where we learn the basics, where we get the required knowledge to, become a doctor. But then along the line, I think practice and experience will definitely shape how good you become. And I feel what is really important, we know that academic knowledge is really crucial for you to become. You have to know what you're doing. You have to know how to do it. You understand. But then I think interpersonal skills, the effective communication, empathy. As a doctor, if you would ask me to define a good doctor, I would not even go to the academic part, because I expect everybody that has gone through medical school, to be equipped with that. But like they always say, even our certificates, they're always in character and learning. It's not always learning, your character, your empathy, the way you relate with your patient. Every doctor is different. You would find, even if they're pediatrics, the way there'll be a pediatric that most of the children like. And it is not because maybe there's somebody superior to him that knows the thing more than he does. But the way he relates to the kids, the way maybe he can come down to their level, admit them, have empathy, even some sickness sometimes, as our lecturers tell us, it is not even a physical sickness that you can see. Some people, it is emotional, or sometimes it is mental. But then if you are a good doctor and you are able to let your patient confide in you, all those tips, I feel that is what would really make you a good doctor. Even with practice, with the knowledge you have, you would have to really work on your interpersonal skills.
Wow. So that was a very enlightening first session. We're going for a short break. We'll be back in a while. Welcome back. I hope you're enjoying our discussion so far. Rufaida, there seems to be like this secret dating club among medical students. Medical students and professionals, they usually end up dating or marrying their colleagues. So what's the story behind that?
All right, let me go first. I think medicine is, should I say, it's a cult. No, let me be honest. I should say it's a cult. And one thing with cults, you want to preserve that heritage between you guys. But still, you have a lot of people. I have a lot of friends that will tell you, okay, they can't marry a medical doctor. I have them. So it's not like all of us are saying, okay, we want to marry a medical doctor. And probably it's because of you understand each other. You understand the tedious nature of what you are going through. Yeah. So you need somebody that will be your companion in going through the journey. Like we said before, medicine is stressful, is demanding. So maybe people tend to need someone they walk through the journey together, and then they will be at the end of the tunnel together while understanding each other. So maybe that's why most of us tend to be on that side of the wall.
Okay.
Yeah. I feel definitely having a shared of the understanding of how medicine is would definitely make for a more harmonious relationship. And at student level, I think there is a special kind of bond that is created from, experiencing the same pain. In medical school, we cry together, we laugh, we feel sometimes together, we pass together, and, we study late at night together. I think that kind of experiences you go through makes some people to create a bond, and before you know it, they fall in love and they end up maybe married or something else. Yeah. And even as women, societal wise, we're always told it is better we go for somebody that would really, give us, will be wives, will be mothers, and getting somebody that would really support us, somebody that is really in understanding of what we're doing would really make things easier for us.
Yeah. Okay. So it's that at some point, every medical student has this existential crisis where they're wondering, why am I even here? Like, what brought me here? So have you ever experienced that, and how often is it for you?
Okay, I think this question has a permanent spot in my brain because it's like a daily mantra sometimes. When you wake up in the morning, you ask yourself, why me? Why did I choose this? You question your life changes, especially when the stress gets too much, you have so much to study, the pressure to pass and all. You just keep wondering, there was a million things for me to do, but I decided to do this. And at that point, I think you just have to remind yourself of the reason you went for that, and you have to know that you just have to keep going sometimes.
To be very honest, I've never questioned myself.
Wow.
I've never. Nice. And every day I'm seeing this is the best choice I've ever made, I think, in my life. It's the best choice. I've never doubted maybe why medicine. Because like I said, it's either medicine or nothing else. And coming to experience what I'm experiencing now, the joy I get, the happiness I get while doing medicine, studying medicine, I think is just exceptional. I think my experience will be, exceptional, just perfect. I think
that is why, funnily enough, if you would still ask the medical students if they will do anything else, they will tell you no, it's still the medicine because
that's what they want.
Yes.
So, what's the best piece of medical advice you've ever received? Medical school related advice.
Oh, okay. I think that would be to understand myself, to know my weakness and my strength, and how to manage my time effectively, to know how to balance between my personal life and my studies. I think that is the best advice that has worked for me so far.
So mine will be, beside medical degree, what value are you going to add to the certificate? Because like I said, there are other things, there are other skills out there that you need to survive. So I feel that's my best advice.
Okay. So there's this sense of superiority that medical students and even professionals sometimes have. Like when they're looking at people in the other allied health fields, they think they're lower class people, like even the title doctor given to some of the allied health fields, they feel like they're not deserving of it. So why?
All right, so let me not maybe take you out of context. So maybe if we explain further, maybe cite an example so that, like I said, let me be in the context that you want me to answer this question, maybe so highlight a little bit, and then I will see what I feel maybe is the problem or the issue.
You want me to
explain? Maybe cite an example or something.
So, like for example now, there's this, maybe for optometry, there's doctor of optometry course now. So medical students and even medical professionals, they feel like that title should only be reserved for medical doctors. Any other thing outside of that should not be called a doctor. If you're an optometrist, you're an optometrist, you're not a doctor. You get what I'm saying? So why do you think this sense of superiority exists?
All right. Firstly, let me say this is my opinion, but I don't know. Like and like I said, maybe my opinion might be really wrong. But then what I'll say is, I feel all this it's actually political. Does this argument really maybe impact on the outcome of patient management? Does it really impact on the situation of our hospitals? So
In a way, like if there's this bad blood between them, they can be sabotaging each other. Like maybe when it comes to referrals or something, they'll be like, no, I don't want to take him to an optometrist, or the optometrist will be like, no, I'll handle this myself. I don't want to go. If the relationship between them is not good, they're supposed to be a team. So if there's this sense of, no, we can't work together, no, you think I'm better, there'll be a problem in the healthcare.
So everything comes down to there is a modus operandi of how you work. And everything, there is a protocol in what to do. There is a protocol of maybe when to refer, when not to refer, when to look for a specialist, when to look for this. So everything has been stated clearly in the hospital. There are modus operandi, like I said, guiding the conduct and affairs of how you do things.
True.
So if we stick to that and then we stay away from all this politics, like I said, let's channel our energy towards the welfareism of health workers. No one is enjoying the work maybe now because of this current situation of the country. The salary is not really good. The working environment is not really conducive. So why not channel this energy towards improving this, and then maybe bring down all this superiority. Like I said, in everything there's a modus operandi guide. Okay, who should lead this team? Who shouldn't lead this team? Who should be part of the team? Who should go for this position? So everything has been stated clearly. It's just maybe we are being political and then our heads are divided. I feel it's better for us to unite ourselves and then come and see how we can improve the healthcare system instead of fighting an internal war that will not end, because maybe most of us grew up and then we heard of these stories of all these internal issues. So like I said, it's better we just come unite ourselves and then maybe bury down this superiority complex and then inferiority complex and then see what will come out tomorrow from let's have a brighter future, I feel.
So if you could give a medical student, someone who wants to start medical school or a current medical student advice, what would it be? Let's start with Rufaida.
Okay. I think what we don't tell people about medical school sometimes is that it is there. I feel the academic stress and the academic workload is easier to manage sometimes than the emotional distress we go through. This is something a lot of people don't know. Sometimes it is not even the sheer amount of workload you have to do that bothers you. It is the fact that you can't find yourself to get to study. You know, you open your books and you stare at them and they stare at you back. And you have this nagging feeling that you are supposed to do, but it gets so overwhelming sometimes that you can't find yourself to do that. So that is why I think finding a relaxation technique as a student, you have to prioritize self-care other than medicine. And like he has been saying, you have to find other skills things you are interested in. It is not, don't be studying every day. It will not finish the syllabus. You would never finish it, I'm sorry to say. And it is not something, you can actually do. But if you find relaxation techniques, there are many ways to study, Other, it's not cramming, you memorize, you understand. There are mnemonics. You have studying techniques that will make you better. I think I really want to tell you need to balance your personal and your study life. It is not all about studying. We are medical students. We have our life outside medicine. Like he said, you find something you have interest to and also do. Just know that this is maybe something you will have to do. You have to pass because we don't even have an option to fail sometimes. So I think that is what makes us to just keep thinking you have to do that. But sometimes even when you rest, you find yourself studying better. I think this is what I have to say to anybody aspiring to become a doctor. Please join us. We're really welcoming. We're lovely to be part. We need as many people as possible. Yeah. And it is not as grossly as people say it. It's a piece of cake, I assure you. You'll do just great. Yes.
It is. Okay. So I think we're on the same page with regards to that advice. So,
So if you could change one thing about the medical system in your country, what would it be?
So with regards to medical education or with regard to the medical system?
Anyone.
Okay, I'll go for the medical system. Maybe I'll improve the system. Because if you look at our medical education in Nigeria is good. Anywhere we go, you find us, we do well. So I feel the system, we don't have a lot of equipment. We are not that buoyant. We are restricted. Our hands are really tight when it comes to some investigations. So when it comes to diagnosis, you have limited options of what you can do. So I would say maybe I will improve the system okay, everything should be available. When doctors need something, it should be there for them. Like I said, the medical education, I feel it's good, one of the best maybe across the globe.
All right. Thank you guys so much for coming. I had so much fun having this conversation with you. We're at the end of the show. Thank you for watching. Please subscribe to our YouTube channel and follow us on our social media pages. We'll see you on our next episode, inshallah. Thank you.